Good morning. Thank you for invitation. I'm Professor Adib from Marrakesh, Morocco. I'm the Vice President of the Moroccan Society of Medical Simulation. And I was invited to talk about virtual patients and the potential of accelerating critical thinking of the next generation of learners. So it's a little bit difficult topic and my English is not very good English, so I will try to do my best to share ideas about this topic. In Marrakesh, we use Body Interact since 5 years ago, and we are very satisfied with it. And we use it for many levels in medical studies, and also we invite the nurses to share with us experience with Body Interact. So you can find many things about that in our webpage on Facebook. For our center. First of all, for years and for decades, medical studies was concerned especially about basic foundation thinking, remembering, understanding, and applying. And now we are more and more interested with the higher order of thinking in our medical studies, analyzing, evaluating, and designing. And we see arriving in our schools new generation, which called Z generation, digital generation, who are very, very interested in active learning, not passive learning. And we have concerns with them because we have growing number of learners, and we have as we introduced simulation in our medical studies, we have problems with chronophagy of classical simulation sessions. But we know that simulation is very important, and we have enough data talking about the positive effect on learning and clinical reasoning. Concerning simulation, we have also enough data about the importance of active learning, especially with simulation in a real experience. And now we have virtual patients introducing this kind of learning. Especially about the concept of virtual patients as a video game, as a serious game. We know that this kind of games, they permit active learning, interaction. They keep learners very, very interested with attention, with guidance, and these games give them feedback with scores. And by repeating sessions, we have consolidation of their critical thinking and clinical reasoning. And this simulation is very interesting in all stages of the learning curve, of expertise curve. So we can have accelerating competency at the start, and we can maintain competency when less exposure to practice. We can use also simulation to acquire teamwork competencies, and also for experts by limiting risk taken by these experts. So simulation is very important at many stages. For medical students especially, we have a meta-analysis about virtual patients that showed clearly in many studies that virtual patients permit improvement of knowledge outcomes and also skills outcomes. And especially in this study last year, it showed that virtual patients can enhance extraneous cognitive load, especially in students with low prior knowledge. So the youngest can benefit much more from virtual patients, especially in the items of clinical reasoning. If we can see only studies that were interested in body interact, this study in 2019 in nursing students, it showed the potential to improve knowledge retention and clinical reasoning in an initial stage and over time with a follow-up more than 2 months, and it increases also the satisfaction with the learning experience among nursing students. Also, another study, very interesting about body interacting medical students, showed improvement in clinical reasoning items, especially in clinical reasoning items. So it's very important that this virtual patients integrate curricula. For example, in Marrakesh, I share with you a study we did in our third medical year students. As I told you, since 4 years ago, we changed all our clinical reasoning sessions in third medical year to body interact sessions. And we did a questionnaire to the promotion about their satisfaction in many issues. And the study showed more than 87% satisfaction that the decision permit to enhance medical knowledge and clinical reasoning. And also they permit to be better in clinical reasoning. And also in many items in the questionnaire, students were very satisfied by more than 97% about enhancement of technical competencies, communication skills and teamwork skills, and also for stress and emotions during the sessions. And they are convinced in 97% also that these virtual patients are very important as a complement to theoretical courses and workshops, and they permit to enhance the safety for patients. And in total, our students in Marrakesh were very satisfied with body interact sessions, 99% satisfaction, and they want these sessions to be integrated completely in the curricula. Another issue very important is about evaluation and assessment. So as you know, simulation now is becoming a very important tool for certification in Anglo-Saxon countries, especially for physicians. And for example, the American Heart Association use virtual patients for certification in BLS, ACLS, and pediatric advanced life support. And I wanted to share with you a study in 2017. They compared serious games with virtual patients to MCQs for assessment of students. And they found that there were more variability in grades compared to MCQs offered by virtual patient series games, and there were a good student satisfaction. So it's now also virtual patients may be in the future a very important tool for method of evaluation. So for conclusion, yes, for sure, virtual patients are important in enhancing and improving critical thinking in medical and nursing studies. But it's not the only tool. They have to be integrated completely in the curriculum, especially in topics of clinical reasoning. And we need also to do much more studies to assert and to certificate this efficacy in studies. And for sure, future will be in medical studies with a huge amount of evolution of virtual patients. Thank you for listening.